Hey everybody, this is Dr. Daniel Eamon. I hope all of you are well. I have a friend who is going to join me. Let's see if we get it to work.
We did it!
Hey, how are you?
I'm great. How are you?
I am having a pandemic Tuesday. So nice to see you again. So for people who don't know, this is Dr. Daria Gillespie, who's a friend of mine, who's an ER doctor, CNN contributor, best-selling author, and we decided we would hang out together.
Yeah, exactly. We can't see each other in person, so we're doing so virtually, even if it took us 20 minutes on Instagram, right?
Oh my goodness. And who knows why it happened, but here we are. Do you have time?
Yes, absolutely. I'm excited. I was thinking, you read brain scans and MRIs, and I read EKGs and chest CTs, and we can't figure out Instagram. So there you go.
Well, I was doing the right things. It just, for some reason, had to reboot my phone, which was irritating. But,
well, I'm glad you're here.
In the scheme of things, so what I thought we'd talk about is how to get healthy during a pandemic. I came up with a term you'll like. It's called pandemic squared, because the next pandemic that's going to happen is a mental health pandemic. The domestic violence, divorce, trauma, emotional trauma, grief, anxiety, panic attacks, OCD, all of those things are going up. Yeah. And so how can we help people really take the extra time? Because most everybody has extra time to get really serious about being healthy.
Yeah, I think you're right. And I worried about that when this first started. I worried about the mental health, overdoses. I think that's a real concern. We're seeing it in the emergency department. So I'm glad we're talking about it.
Now, have you been working in the emergency department while this is going on?
I have. It's been very interesting in terms of the difference in patients we're seeing, the new guidelines, and how we're treating patients, just some logistics, the way we take care of patients now. And we all have our fancy masks as well now. I have a little respirator mask that I use for intubations, and I look a little bit like an alien.
So I was an infantry medic, and I was really there to support our soldiers. But now you're the first responder for this war. How's that been for you?
It's, I've never been in the military, so I can't even equate it to have no idea what that experience is like. But it's one of the biggest challenges has been the uncertainty of it, in terms of what are we dealing with, how do we take care of this? And really, we've been changing guidelines on the fly, especially the first month. I'd go in and work a shift, and in the middle of the shift, the leadership would come in and say, okay, we're changing actually now how we triage patients or how we test. So that's been one of the biggest challenges, is the uncertainty and having to just kind of improvise and change on the fly. It's also been interesting because we've seen an increase in our respiratory problem patients, but a decline in every other patient, including patients with mental health issues, which gets exactly what you were talking about in the beginning, worries me, because I know that people aren't having less heart attacks and less depression and less anxiety. It's just that they're staying at home with it. And I think that's something that we both are concerned about.
Well, and emergency room doctors are often the first responders for domestic violence.
Yes.
And now nobody wants to go to the hospital because they're worried they're going to get COVID-19.
Yeah, and there's that concern. And then I had one patient who I asked her why she had delayed coming in, and she said, well, I didn't want to take a bed away from a patient with COVID who might need it. So some people are not coming in because they're worried about themselves. Some people are not coming in because they're worried about other people. And so we're really telling people the message now is it's amazing. We have really a firewall between patients who are coming with COVID related symptoms and those who are coming in with something entirely different, because the ER needs to be a place that you are safe. And so whatever the problem is, you are safe. We're going to take care of you, and we're going to make sure that you're protected from other illnesses that you may be afraid of.
Wow. So what are the things you're telling your patients on how to take care of themselves during this time? Because I know, you're a great ER doctor, but you're also a teacher.
You are, and you're right. Sometimes the time in the ER with someone can actually be a real teachable moment. And I think if anything this pandemic has taught us is the importance of our baseline health. Because what is predicting how severely ill people get in general is their baseline health. And so I hope this is eye-opening and awakening for all of us. And really what I'm telling people right now is because everyone's feeling stressed, everyone's feeling overwhelmed. I'm trying to give them kind of small things to do. Like this, you may say one thing I'm telling people is just to get out and go for a walk. It's really important to get out, get your exercise, good for your mental health, good for your physical health. It's just little things you can do in a time when people seem very overwhelmed. It gives them one small thing to do.
Yeah, now in my new book, The End of Mental Illness, I talk about, one, they're not mental, they're brain. And if you want to keep your brain healthy, or rescue it if it's headed to the dark place, you have to prevent or treat the 11 major risk factors that steal your mind. And I have a mnemonic called Bright Minds, and it's prophetic in the sense that those are the same risk factors. If you have, they kill you with COVID. So for example, the D is diabesity, this really toxic combination of being overweight and having high blood sugar is a disaster if you get COVID, because the fat on your belly produces inflammatory cytokines. The cytokine storm's often what kills you with COVID, and we're spending trillions of our grandchildren's money. We're spending trillions of dollars, and nobody's talking about why the US has 4% of the world's population, but 33% of the world's cases and more morbidity than many countries, because we're unhealthy as a society. And if we don't start getting it together, we're going to have, this pandemic's going to go on and on.
Right. I agree with you 100%. And if we don't allow this to open our eyes and to kind of have an awakening and a renaissance when it comes to our baseline health and wellness, I mean, this is a eye-opening in terms of how important that is, then I think we will have lost what would have been a really good opportunity to refocus on that. And I agree with you on that. Just the same things that benefit our health, our heart, and benefit our brain. It's the same. Just diabetes, obesity, hypertension, all of those things. It impacts all of our organs, impacts our immune system as well. So I 100% agree with you on that.
Yeah, I often say your best defense against COVID is not going to be a vaccine. It's going to be your immune system. Mm-hmm. And, and I'm praying that they have a vaccine and they get this bad boy under control. But your best defense is always your immune system. And so what's your vitamin D level? Are you being smart enough to wash your hands, to really be thoughtful? I often say some anxiety is good. I used to think my job as a psychiatrist was to lower your anxiety. And then I realized for many of my patients, it was actually to raise their anxiety, because then they stop making stupid decisions. And I've been on the radio in London a lot during the pandemic, answering questions for people. And one of the callers said, what we're in is a global amygdala hijacking. And I love that.
There you
because,
go.
The amygdala is the part of your brain that responds to fear. Mm-hmm. And, I know you're a contributor to CNN, and I've been on Headline News with Lynn Smith. Mm-hmm. Recently, we did Brain Week. And but you have to be careful with the news because they tend to grab the most sensational headlines because it always has to be breaking news, but they're scaring a lot of people when most people I know, most of my patients actually, they like the time off. They're closer with their families, and you know, we need to help people be cautious but not panicked.
Yeah, I say I need you. So I need you between apathy and panic. I need you in the middle, not on either extreme. And I think you're right. On the news, I think I'm telling most people because you should not be watching news 24/7 and just have that on. I think that definitely impacts your psyche. So I'm telling most people is kind of choose one or two. I myself I have my little list of my news sources here. I review those every day, and then you don't need to be watching it constantly. Shut it down. So you stay informed, but you're not constantly being inundated with it. And I actually have kind of a new paradigm where we're talking about with how do we look forward with COVID for the next 3-6 months. One is just we talked about maximizing your health and making sure that you maximize your health, and that eye-opening. This should be that moment to realize how important our baseline health is, and then minimizing your dose of exposure to COVID. I think in the last 3 months, it's been all about making your exposure zero. And we're not going to do that anymore. As we start to reopen the economy, we're accepting that we're going to have some amount of risk for those who are otherwise healthy, who can go out. But to look at ways now, it's no longer binary. Now is how can I minimize my exposure dose? And helping people understand what a framework is to do that so they can decide how to move forward.
And so how do you recommend they do that?
So, and again, so we kind of have a framework because it's different. What it is in New York City is different from Kansas or Atlanta, where I may be. So I tell them kind of the 4 Ds. One is, kind of first line of defense is that mask. When you go out, making sure you wear that. And again, this is for people who are otherwise healthy. The medically vulnerable, they still need to be firewalled. But then secondly is duration. It's first line of defense is your mask, then duration, distance, and density. So the duration gets to the fact that, aside from if I literally sneeze in your face, I can sneeze enough viruses, particles of COVID that you could potentially catch COVID. But if we're just speaking together, I have COVID, not that when I don't, but even if I did, a single breath wouldn't be enough to spread COVID to you. Maybe speaking together about 5 minutes or so would be. But if we're just also, so separate that from if we're just sitting together, neither of us is speaking, maybe we're watching a movie, then you get to 30 to 60 minutes of time is how long it would take to spread COVID. So it's important to look at what is the duration of time with somebody. If you just walk past somebody, pass them on a walkway outside, that duration isn't enough. That's likely not going to make you sick. So I want people to start thinking about that. What's the duration I have with a person? If it's just a single pass by, that's a low risk. And so another is distance. So we're saying 6 feet. And again, I tell people 6 feet is because 6 feet away is when most of the particles will fall. That's a key point. It's not the only thing. That's why it's one of the Ds. And then the last is density. Look at how densely packed a room is. And we've heard about that one choir where one person spread the virus to multiple people. So are you in a very dense room with maybe poor ventilation, or are you in a well-ventilated room with very few people? All of those are how you can weigh your own risk. And I think that way people can start making their own decisions.
I love that. That's really smart. So, a lot of people think it's not that serious, that this is a weak virus. You're in the emergency room. Tell me what you've seen.
So people have said that. People have said, oh, this is just the flu. This is not a big deal. We've seen some really, really sick people. We've seen really sick people of all ages with really low oxygen levels and who will seem okay and then suddenly are not okay. So this is not just some weak virus that everybody's making a big deal out of. This virus makes people ill. People need to know that. The good thing is that, yes, most people who get this virus, especially if they're otherwise healthy, will be able to fight it off. But even I know people who are in their 30s and 40s and they were sick for a week or two, but then they truly felt deconditioned for 2, 3, or 4 weeks. So it's not a virus that we should be cavalier about. And I think people are being cavalier because many areas are just not seeing people who are affected by it. That's good. We want to keep it that way. So let's not be, just erase all the benefit we've done. We've done lockdown. So now let's be smart about the next steps. And now instead of thinking, again, we're not avoiding the virus anymore, we're opening up. But I want people to start thinking about what's your dose of exposure. Because again, the second thing about dose is that we don't know from COVID, but we know from tuberculosis and some other diseases that if you get hit with a huge dose of the virus at once, say you are working in the ER, taking care of a really sick patient, or you're in the subway and there's many people who are sick around you at once, you're likely going to get sicker than if we go out and we go smartly, and then maybe you're exposed to one person who has COVID and you get sick from that, you're going to be less sick. That's why dose is what we need to be looking at going forward, because even if we get sick, we want to keep you from getting super sick from it.
So, when I hear that it's not serious, I have 8 clinics around the country, and I have one in the epicenter in Manhattan. Actually, a lot of my clinics are where, I have a clinic in Atlanta, and Seattle, and San Francisco, and Los Angeles, and Chicago. But the epicenter really was New York City. And a 30-year-old employee of mine got it and ended up on a ventilator for 5 weeks. So whenever, people go, oh, it's not that serious. And yes, we sort of know the risks. You're older, you have diabetes, hypertension, obesity. So, I find my brain often does the ping pong thing, and isolating people actually damages their immune system. And so being smart and managing your exposure, I think, is critically important. I hate seeing the whole thing politicized. It really makes me crazy.
Yeah.
And it almost seems like there's a whole group of people rooting against hydroxychloroquine. Both my mom and dad had it, and my mom swears hydroxychloroquine saved her life. And I read the studies, and they're just like all over the place, but yet we really don't have that randomized controlled trial on a lot of people yet. And I'm rooting for whatever works, right? I've got no dog in the fight, but I know. Go ahead.
No, I absolutely hear you. And I feel like there are 2 groups there, and based on people's politics, there's one group that, one person, whatever they say has to be right, and this other group, whatever that person says has to be wrong. And I think you and I know in medicine that any one study doesn't beget a standard of care. We understand that in medicine, a result isn't something that is a standard of care unless we can reproduce it. So you and I know that we have to be able to hold sometimes conflicting evidence and be able to weigh it, and at this moment keep moving forward despite that uncertainty. As an ER doctor, and I'm sure you as well, sometimes we don't have all the information we need. We have to be able to move forward, but it doesn't mean we have to be dogmatic about it. And I think that is because of the politicization of all of this. People are getting dogmatic on both ends. And the reality is, this is a virus that we didn't know existed 6 months ago. And we're just learning how it works.
And you're in Atlanta, right?
I am.
And so Georgia's opened up.
Yes.
And for a couple of weeks now.
Yes.
And are you seeing more people in the ER, less people, sort of about the same?
I think it's sort of about the same. I haven't looked at the statistics this week. It has been, it's managed to stay manageable. My main concern was I think two things we all need to be looking at going forward is we need to make sure our hospitals are staying online, that they can handle their elective surgeries, and that we get the kids back to school in the fall. Those are my two goals. So to date, it looks like the demand for hospitals for COVID has stayed underneath the supply. They're able to restart the elective surgeries, and that's happening. So that's really promising. And what I tell most people is I'm making decisions on kind of an every 2 to 3 week basis. And again, that comes from having to hold, I have to hold uncertainty. And I like certainty. I had my entire summer planned for my kids. We knew what we were doing every single day from here till the end of August when school started. And now I can't say that anymore. And so I did a segment this morning on Headline News, and I told Rob and Mead, I said, I'm planning in 2 to 3 week increments. And my kids are doing virtual camp for the next 2 to 3 weeks. And then in a week or two, we'll decide what they do after that. And I think that's what we have to do. We can't be dogmatic. We can't be political. We just have to be smart.
Someone asked, I was watching the chat, if our clinics are still open. They are. We've been scanning the whole time. And we have a clinic in Encino right next to where she was at. A lot of our colleagues, I'm on the radio in London with an ENT doctor from New York, and she had to close her practice because no one was coming. And what I'm seeing is the healthcare workers, the doctors, the nurses, everybody, the supportive staff, many people are getting laid off because of how they manage this thing, that everybody's afraid. And so people aren't getting the health care they need. So as I talked about pandemic squared, well, it actually may be cubed, because if you damage the healthcare workers, if you damage the first responders in this pandemic, well, that's not a good idea. We just have to be so thoughtful. How old are your children?
3 and 6.
And so are you doing the homeschooling?
Yes.
How's that going? It's going. I may need to be calling you for some mental therapeutics. No, it's actually, it is definitely challenging. My kids so far, while I've been on air, have not walked in the room like that guy from the BBC. Do you remember seeing that interview? He's doing a BBC interview. There's so many things I've heard from a guy having an affair and the girl walks by.
At least I'm not at risk of that, but I am at risk of a 3-year-old walking in at any given point in nothing but a diaper or nothing, because he's this little 3-year-old boy that has no shame. And it's been challenging because most of us, are used to, we have our family here and our personal life here, maybe your career over here. It's these lovely circles with a slight overlap in their Venn diagram. And in the last 6 weeks, all of those lovely circumscribed circles have all been smashed together all at the same time. So now you're balancing all these things. And it's definitely been a challenge, but, I try to take my own advice. My husband, it's helpful. I guess in my TED Talk, I talked about triaging your life. And my husband, sometimes for better or for worse, if I'm not doing a great job of triaging my life, he reminds me to do so. But so you really have to do that when you have work at home and kids at home and everything at home, to say, okay, what are the 2 or 3 most important things I'm going to do today? What are those? And then also, what can I eliminate off my list? And it's been huge for mental health for me. So that's really key.
Just answering another question. Yes, we have a clinic in Chicago. I think if people are paying attention, they're going to start cutting out a lot of things in their lives that are non-essential. That, as people are thinking about, well, what businesses are essential, that a whole bunch of people learned how to cook. So they're not on the run, and they like that. And they're like during this pandemic, I learned how to brine fish. And I'm like,
wow,
this was awesome. And then I made my first rub for a tri-tip steak. And I barbecued. I was like so proud of myself. So I think,
I'm proud.
Thank you. My dad owns a chain of grocery stores, and they've been so busy, and it's devastating to the restaurant industry. And Alan Greenspan, many years ago during a recession, he talked about a concept called creative destruction. Is that when we go through a hard time, some industries get destroyed, like the horse and buggy, but others then become creative. And telemedicine, there was an article on the BBC that said telemedicine progressed 10 years in 1 week.
Oh, yes. I think so. And I hope it stays, because there have been so many people. I think it's wonderful. And an important thing about telemedicine, I think, is being able to see your own doctor. And that was one of the places it felt like was a step that we hadn't crossed yet. And so I think now people are able to do that. And I do hope that it stays. I hope that some of the regulations that were loosened to make it possible, that we figure out a way to start to bridge that so that we can continue that telemedicine, because it's huge. And especially, on one use case is psychiatric services in rural areas where they just don't have enough practitioners. So there's so many different ways that telemedicine can be used. I hope that this is one of the good silver linings that comes out of this.
Well, we do telemedicine. We've actually done it for like 25 years because we have patients from 155 countries. And so, often they'll come, they'll get scanned, and then they'll go back to Singapore or Hong Kong or Russia or wherever. And once I see a patient, I don't want someone else messing with my treatment plan.
Right, exactly.
And so we follow them.
You take care of them. They're like your little child. You're going to take care of them.
Yeah. And I don't think I miss that much by being able to see someone and talk to them, because, for me, I want to look at their brain, absolutely, because if I don't look, I don't know. But I also want to know how they're feeling. I want to know what their wife thinks about that. I did a marital therapy session yesterday on Zoom, and I thought it worked fine. I think this is a good disruption. Online learning is going to be another one that we just have to figure it out and do it better. Yeah. Online events, because there's not that many of us that want to be on a plane at the moment. Not right now. Or in a massive auditorium with 600 other people. And I see somebody just said, how do you do vitals and all on telemedicine? I think that's part of the continued challenge. I think psychiatry, maybe some primary care is fantastic for telemedicine. I think some of the others, we still have to figure it out. But I always tell people it's great to at least triage with your doctor over telemedicine. And then if they need to bring you in, they can to see you. So I saw a 2-minute video from Israel. And they delivered to home this little package. And it had a thermometer, it had a stethoscope, and it had something that you could look into someone's mouth with. No kidding. And it was stunning how, I'm like, future of medicine. Because it then becomes more widely available. Yeah. And isn't that really what we want? But, I want you to help me. In the end of mental illness, I really, at the end of writing it crystallized to me, the end of mental illness will begin with a revolution in brain health. And when we get really serious, and when brain health, as you and I both know, is total physical and mental health. Right. So you got to get your heart right. You got to get your pancreas right. You need your gut to be well. You need your kidneys and your liver functioning properly, and your immune system. Right. And so the end of mental illness begins with a revolution in brain health. And so we need healthcare revolutionaries. It's like, look, if you want to get on top of your depression, this is not a Prozac deficiency. It could be your thyroid's not right, or you're drinking too much, or your home has mold in it, or, you know, any number of things. And so it's getting the healthcare workers doing it, and then it's the people. And what I love about you is your work is hands-on and clinical, but also you take that and you teach large numbers of people how to be healthy. How can people learn more about you and your work?
Sure. So, and you're right. That is my mission. And it came from being sick myself, developing my own autoimmune arthritis and having to figure out how do I heal myself within Western medicine, but within Eastern medicine and integrative and holistic and, you know, mental health, and how does that all tie in? Because it does. So that was the purpose. So we just launched a new website, drdaria.com. We just relaunched it with the goal of creating a lifestyle guide for people that has a scientific soul, meaning that we look at Western medicine, integrative health, holistic, Eastern, acupuncture, psychology, everything, and how it all ties together to make people's lives healthier, better, and easier. And so that's where I do most of my work there. And also on Instagram, I've been answering. We realized COVID, the news is changing so quickly. I've just started answering questions on Instagram in stories and letting people ask me their questions and then doing videos that way. So we can keep people the most up to date. So,
That's
and
awesome.
yes, and I do have to mention, we're super excited, as you and I were talking earlier, is my TED Talk that just got relaunched last Wednesday. I gave it actually in November, and it was on triaging your life to end the crazy busy, with the thought being that I'm an ER doctor, and no matter what comes in those doors, crazy busy is a phrase you will never hear me say, because of the way that chronic stress impacts how we act and our productivity and how we can function. It's all the stuff you know about. Is that you were just saying, the amygdala activation. So it's how to end the crazy busy. Because I think we have an epidemic, obviously, of COVID. We have one of crazy busy right now. Everyone is stressed, everyone is overwhelmed, and everyone is being pushed to their limits. And so the question was, how do I function in the ER amidst everything happening there to not be crazy busy? And how can I share those lessons in our regular lives? So that's at ted.go.com/Dr. Daria. And Dr. Daria always has 2 R's in Daria.
And if you had to give the people listening 2 or 3 tips on how not to be crazy busy, what would you say? So
one is, we alluded to it before, I want you to look at your list of everything you think you have to do today, take one thing off, and then choose the one next thing you're going to do, and just do that. Just aim for that. Cut out everything else. Turn off your multitasking. Turn off your email pings of Nordstrom shoe sales that are coming in right now. Just focus on that one thing. Another tip is to design for chaos. As we know in the ER, we're not surprised by the crashing patient. We expect that they're going to come in, and we design for that. So we have little tackle boxes of all the equipment we're going to need for that. Or we have checklists so that when you're in that moment of overwhelm, you're not trying to reinvent the wheel. So design for chaos. Have saved lists that you use every week for your grocery store. Automate as much as you can, because you should put your toilet paper on subscription. Well, toilet paper is a separate issue right now, but sure, dish detergent or things. But we don't have the I don't have the extra cognitive power right now to worry about if I have enough dish detergent. So that's a little thing, is design for chaos, automate as much as you can, saved lists. And I think the last one kind of gets to filling up our own bucket as well. And right now I'm telling people when I get stressed is to look to another person who needs me. And especially when it comes to my kids right now, with them being home, finding those little moments where I can say yes, because nothing fits my normal schedule right now. And it can be so easy and automatic to say, no, you can't do that. We have a schedule. But instead I'm trying to just say yes. So my kids the other day pulled out the umbrella, and I look, the next thing they do, my 3-year-old was holding the umbrella. My 6-year-old was spraying the hose up in the air, and it was falling on the umbrella on top of the 3-year-old. It was totally ridiculous. And I normally would have stopped them, but instead I'm trying to say yes more. And it means that amidst this chaos, we're having some moments of unexpected fun.
I love that. That's so helpful. Well, it's so nice to see you today. We should do this more often.
Let's do it.
I pray you stay safe and healthy. Um, I mean, ER docs are so important right now to help us get through this insane time. I think of it really as a historic time. We're going to remember this for the rest of our lives. Our children, our grandchildren will remember it. Thank you for all you do.
Thank you for all that you are doing. I greatly appreciate your work is so valuable. I can't emphasize that enough to anybody watching. So thank you.
Good.
And yes, let's do it again. I see somebody said do this again. Okay, Peg, we should.
All right. Great seeing you.
Good to see you too. Bye.
Take care. Bye-bye.